everyone, my name is Viva and you're watching Peak Life, brought to you by the PeakDay app, inspiring us to all live our best natural lives. So let's talk about postpartum. In recent years, the word has a bit of a negative connotation, but it simply means after the birth. It's just the period of time after you have had a baby and are at home caring for your newborn. You are in the thick of it and learning as you go with your new baby. You also may be experiencing your own physical symptoms after the birth that you may not have been prepared for. Let's talk about a few of those common post-childbirth symptoms and look at some strategies and nutritional tips for alleviating some of the negative aspects that you may be experiencing. Along with covering the recovery strategies and nutrition we will talk about in a minute, it's important to understand what your return to fertility will be like and how to practice natural family planning after childbirth. Now, let's talk about what to expect after you have given birth and those physical symptoms you are most likely experiencing since childbirth, and some strategies for lessening their impact. The one postpartum occurrence that is probably universal to every woman is exhaustion. As your body has likely been through the most strenuous work of your life, you can expect to feel a level of exhaustion that you may have never experienced before. You may also be feeling achy and stiff as well. I know it's easier said than done, but remember, rest when your baby rests. It's not the time to get a few things done. Focus instead on your healing and on your baby. The housework will always be there. Heat or warmth promotes blood flow and healing. A warm, not hot, sitz bath is recommended. Cold decreases swelling and numbs the area, and thus ice packs can provide relief. No one wants to experience this, but hair loss after childbirth is fairly common. In the early weeks and even months after childbirth, many women report that their hair seems to be falling out. And as your hormone levels return to normal after childbirth, hair loss may simply seem excessive. No treatment is necessary, but good nutrition and a multivitamin can't hurt. Then there are the postpartum blues. Many mothers experience weepiness or sadness in the early days and weeks after giving birth. For 50 to 75% of mothers, this is actually a normal experience that results from hormonal fluctuations. You may also experience mood swings, crying, anxiety, impatience, or lack of concentration. These symptoms are usually mild and disappear within a few weeks. However, never brush off what you are feeling and have a trusted person you can talk to for support. Never hesitate to talk to your doctor about what you're experiencing. Be sure to get plenty of rest, eat a healthy diet, avoid processed foods and sugar when you can, concentrate on your recovery, and rely on others for household help. In order to minimize difficulties or promote healing from many of these postpartum occurrences, good nutrition is very important, especially during your first 6 weeks postpartum. You should strive for a balanced diet of protein, complex carbohydrates, such as whole grains, fresh fruits and vegetables, and healthy fats. Avoid trans fats, processed vegetable oils, and empty calories like sugary or pre-sweetened products. Be sure to include healthy essential fatty acids through certified toxin-free fish oils, cod liver oil, flaxseed oil, or healthy fish. Many doctors recommend taking a vitamin and mineral supplement that includes calcium. If you've not already done so, you may want to discuss this with your doctor. The time after childbirth is full of new and joyful experiences with your baby. There is a new little human in your life who loves you. Take care of yourself. Rest when your baby rests. Eat healthy meals and snacks. Don't ignore the symptoms that just don't feel right. And recruit your spouse and family to take care of household and other duties so you can focus on healing and caring for your baby. Learn NFP has an online course about NFP and postpartum and what to expect when your cycle and fertility returns. There you will find the self-paced video lessons, a postpartum guide for moms, and access one-on-one instruction with a fertility coach. The short, easily digestible lessons cover the basics about your reproductive cycle and fertility information, how bottle feeding affects your return to fertility, and how a delay in the return of ovulation may be possible with breastfeeding, along with the benefits of breastfeeding to you and your baby. The lessons also include how to record and interpret your returning signs of fertility and a discussion of marital intimacy and responsible parenthood. Check it all out at www.learnnfp.org.